Well, there is a huge demand for trained employees in many industries, especially hands-on healthcare. Professional Education Services is the sponsor of this segment and offers certified nurse aide training along with other professional training and development courses. And today we have Dr. Amelia Kenyon and Naomi Schoenmaker here in studio with us to explain the program and how maybe you could get involved. Welcome to 8 West.
Thank you for having us.
Yeah, so give us an overview of exactly what kinds of training opportunities that you have.
Sure. So Professional Education Services primarily does CNA training, Certified Nurse Assistant training. Our CNA training is about 2 weeks in length. It's a 75-hour course, but we also do professional guardianship training where people can learn to become a professional guardian, which is a very needed service. And then we also do quote requests for people who need different curriculum and things like that as well.
Yeah, what exactly does a CNA do if they go through your program and they are trained? What kinds of jobs would they perform?
They can do, they can work in nursing homes with our elders. They can work in the hospital. Some of our aides go to the emergency room. They can, they help service the nurses and the patients in the hospital. And then we have ones that work is assisted living. They work as aides there. Some of them even pass medications.
Yeah, who would be a great candidate for a career as a CNA?
Anybody who's interested in working in healthcare, because working as a CNA, I know I started as a CNA, Naomi started as a CNA years ago, and it was a great way to get your feet wet in healthcare to say, is this really what I want to do? Maybe if you're considering going into nursing school or something like that, this is a way to check to see if this is the type of work that you really want to be doing.
Yeah, and what is the demand like? If someone graduates from your program, how quickly are they finding employment?
Immediately.
Immediately.
There is so many people that need CNAs, so many people, so many healthcare services that need them now.
And in terms of the shifts, I mean, it sounds like for someone who may be a mom with small kids or someone who's a college student just looking for part-time hours, nights, weekends, that sort of things, are you finding your students are placed in round-the-clock kinds of opportunities?
Absolutely. And, if somebody maybe prefers to work third shift, that's a great option for them. But there's so many opportunities. Like Naomi was saying, they can work in a variety of different environments. And there's, half shifts, 4-hour shifts, 8-hour shifts, 12-hour shifts. There's round-the-clock shifts. Those that work in home health aid may choose to do a live-in option. There's so many different available flexible schedules, things like that, whatever people need to be able to have that work-life balance.
Yeah, what about that guardianship program that you offer? What exactly would that, who would need that kind of a service?
There's over 14,000 people right now in Michigan who need a public guardian. Some counties only have 3 or 4 guardians per county to serve that. And as you can imagine, that really creates a need for that type of role. In order to become a public guardian, you would have to be able to pass a background check. You have to be 18 or older and willing to serve. And our guardianship training program sets you up with everything you need to run a successful guardianship program for the clients that you're going to be serving.
Yeah, what are the types of classes that someone would take when they come into your program? It sounds like it's pretty accelerated, because for that CNA to get that in 2 weeks, I mean, what a blessing for someone who maybe has a limited time.
Yeah. Yep. And we even have people that come in, and if they're actually working, they'll take 2 weeks of vacation off so they can finish our program. And we offer them, we use videos, PowerPoints, things like that. Our personal experience comes into it sometimes too, and then we take them into our labs and they work on mannequins, and we teach them everything they need to know. And then when we do go out into the clinical setting, they actually have hands-on experience with our elders and the people that live in our residential areas.
Yeah, what about how it is in terms of how people feel when they are working as a CNA? I'm guessing it's very rewarding, or it's challenging, difficult, demanding, but very rewarding.
Yes.
It is. And, one thing Naomi always says, and I like to quote her on this, is she'll tell our students, you're either going to love this job or you're going to hate it. There's no middle ground.
No middle ground.
There isn't.
And one thing that I know I love, especially when we get to go into the facilities for clinicals, is, of course, we have some of our favorite residents that live there, and they're the first to hug you. Oh, my gosh, it's so good to see you again. I'm so glad you're back. And I don't know any other line of work where you get hugs and you get thank yous and you get told thank you for being here, you know, thank you for wiping my nose or whatever the case may be. And that's rewarding work.
Yeah, sitting there just feeding them, having a cup of coffee,
Yes.
having conversation, doing a puzzle or any of those sorts of things as well. What about the CEU credits that you offer? There are a lot of vocations where people actually need to continue to get educational opportunities.
Yes, so our CEU program, CNAs in the state of Michigan are required to have 12 CEUs, continuing education credits per year, and a lot of them don't necessarily get this. So our CEU class is set up, it's self-paced, it's virtual, and they pay one flat fee for the entire year, and then they get all 12 CEUs that they need in that course.
If somebody's sitting home thinking maybe they just don't have the money to go to school for this kind of training, what's the financing option like?
We have so many options where students can actually get their schooling completely paid for. So one of those is sponsorships where we can connect you with an employer who will pay for the entire cost of the course. We also work with Michigan Works, and they have scholarship programs where they help pay for it. We also offer a payment plan option for students that's got a low down payment and then, you know, very affordable weekly payments. So there's lots of different options for those who really want to attend the class.
How quickly can someone get involved in the program? Is there a waiting list?
No, we don't have a waiting list right now.
No waiting list, so immediately. And where are you located?
We have 3 locations in Grand Rapids, the Lake Shore in Spring Lake, and Kalamazoo. And our Grand Rapids location is actually going to be changing this fall and will actually be on the bus line. So we're kind of excited about that. A lot of our students have requested that.
Yeah,
so
that'll make it a whole lot easier. And if people are interested in getting started, they could just check out your website.
They can check out our website, yes.
Wonderful. Well, thank you so much for stopping by 8 West today. I think you probably have a lot of people who are encouraged and interested in taking that step to get that brand new career started.
Thank you.
Thank you so much.
And this segment sponsored by Professional Education Services, and we'll be right back with more 8 West.